Hello students. We are now going to begin with a very important chapter of general pathology, that is inflammation. Now students, at the outset what I want to tell you is that inflammation is not going to help you only in solving questions pertinent to the pathology part, but is also going to help you solve multiple questions that you will come across, especially in medicine. So you can say that this chapter is not only a foundation for this particular subject, but is also a foundation for multiple other subjects that you are going to come across in your preparation for the exam. So please try to focus on this chapter and make a strong base so that the base for the rest of the subjects is also strong. So we are going to take it in the same order and make it extremely systematic and conceptual. So the first thing that we need to know, whenever we are dealing with inflammation, there is one term that tends to go hand in hand. And what is that? That is the term itis. What do I mean by this? For example, I use the term pancreatitis. What does it have in the end? Itis. It means inflammation of the pancreas. Next, we have colitis. Again, inflammation of the colon or the colonic wall. Last example, appendicitis. Again, what is common? The term itis means inflammation of the appendix. So for the rest of all the other subjects that we have, itis, whenever you come across, will mean inflammation. Now what we need to move on to the first important topic of inflammation is how do we classify inflammation. So what is the classification? What is the classification of inflammation? Now students, what I want you to know is that inflammation is classified into two groups. There are two methods of categorizing. Most of the books and authors tend to refer to only one method. We are going to focus on both the types of inflammations and both the types of categorizations because questions on both have been asked. Now the first type of classification that we have is going to classify inflammation into two categories. And what are those two categories? Those two categories are going to be acute and chronic. So we have acute inflammation and chronic inflammation. Now students, just from the basic understanding of the language, acute means something that is quick and chronic means something that is more prolonged and is more delayed. So just if you know the meaning of these terms, you also know what is happening in inflammation. The first difference that you need to know, what is the difference in the onset? Now remember, acute inflammation will be sudden in onset. Will start off very quickly. Will start off within seconds or minutes. It is going to be sudden. That is why it has the term acute. What about chronic? Chronic, on the other hand, is going to be having a more delayed onset. It will have a more delayed onset. Next difference. After the onset, what is the duration of these two types like? So remember, acute is something that is going to begin early and is going to be short-lived. So it will begin early, it will end early. So acute inflammation will be short-lived. On the other hand, chronic inflammation, it is going to begin also slowly, it is going to have a delayed onset and it is also going to go on for a longer duration. So this is going to be long-lived. This is going to be long-lived. So we've done two very basic differences between acute and chronic inflammation. But what we are dealing with is pathology. And when we are dealing with pathology, you have to keep in mind that you will always have something known as microscopic images coming your way. So what is the microscopic examination of acute and chronic inflammation going to show you? When we talk about acute inflammation, that one particular cell that should come to your mind is always going to be a neutrophil. Remember, neutrophil is a cell of acute inflammation, always. How does a neutrophil appear? Let's make a schematic diagram. If this is a cell, neutrophil will be that cell which will have 3 to 4 lobes on an average. So you can see we have 1, 2, 3. So neutrophil will be that cell in which the nucleus is going to have 3 to 5 lobes. Neutrophil is a cell of acute inflammation. Similarly, what are the cells of chronic inflammation? So remember, for chronic inflammation, we have one very important cell, that is the lymphocyte. And we have a cell that is the monocyte. So lymphocyte and monocyte. Now students, remember again, how does a lymphocyte appear? So if this is a cell that we have in the center, over here, right in the cell, in the center of this cell, you will see that there will be a single nucleus. There will be a single nucleus. So no nuclear lobes, nothing that is peculiar about this nucleus. So there is going to be a single center nucleus. That is a lymphocyte. Next, what do we need to know? Monocyte. How do we identify a monocyte? One of the very characteristic nuclei are present in these cells. So again, for example, if this is a particular cell that we have, the nucleus of a monocyte will have a characteristic kidney shape. So in a monocyte, we are going to have a kidney-shaped nucleus. A more medical terminology for kidney would be renal. So the kidney-shaped nucleus can also be known as the reniform nucleus. It can also be known as the reniform nucleus. Kidney-shaped, bean-shaped, reniform. As soon as you see this nuclear characteristic, we are talking about a monocyte. Now, one very important concept that we have over here, students, is along with monocyte, there is another cell that is known as a tissue counterpart. And what do I mean by that? When monocyte is present in the blood, as long as this cell is present in the blood, you will call it a monocyte. But as soon as this particular cell comes out in the tissue, what is the name that we are going to give? We are now going to call it a macrophage. We are going to call it a macrophage. So students, one very important concept, monocyte and macrophage, these are two same cells. Monocyte is in the blood and macrophage is in the tissue. Now, having said this, before we go on to the next type of classification and before we proceed with inflammation, the basic concept in pathology is understanding these cells. If you know these cells, if you've understood these cells, you will be able to easily understand the rest of the images. So before we proceed, let's quickly take an overview of how to identify these cells. Very important. Microscopically, how do we identify? We just made certain schematic diagrams. We just need to fit that in over here. The first cell that we have, just focus on this particular cell. This cell is, if you can correlate with the schematic diagram, how many nuclear lobes is it showing? 1, 2, and 3. What was the cell that was showing nuclear lobation? It was a neutrophil. It was a neutrophil. Neutrophil is going to show on an average 3 to 4 lobes in the nucleus. 3 to 4 lobes in the nucleus. Correct? One question that you've already done, neutrophil is a cell of which inflammation? Correct. Acute inflammation. One more question that I'm adding on for completion over here that has been asked, what is the lifespan of a neutrophil? What is the lifespan of a neutrophil? And remember, it is 6 hours. Now this question has been asked earlier, students, so you need to know this question. Neutrophil, acute inflammation, lifespan, 6 hours.